Hi, and welcome back to This Week in Voice, our special healthcare series leading up to the Voice of Healthcare Summit in August. My name is Bradley Metrock. I'm CEO of a company called Score Publishing based in Nashville, Tennessee. This Week in Voice is our flagship show. We're out of season right now. Season 4 wrapped up earlier this year. Season 5 kicks off toward the end of August and early September. But we're taking the time to do a 5-episode slate of healthcare episodes, each one taking a look at a particular aspect of voice technology and AI and their intersection with modern healthcare. The focus today will be on accessibility in healthcare, and we're thrilled to have an excellent panel of 3 really interesting folks. Tarah, I'm going to start with you. Tarah Knaresboro, right?
Amazing work. Yes, exactly.
Thank you for being part of the show with us. Take a moment, tell us who you are, tell us who you're with, tell us what you do.
Perfect. Yeah, thank you so much for having me. So, as you said beautifully, my name is Tarah Knaresboro. My educational background is in neuroscience and health communications. And I spent the past about 10 years working in voice and chat interaction design within healthcare. So for most of that time, I was the director of voice user interface design at ME Solutions, which is now Wolters Kluwer. And now I work part-time as an independent consultant, developing conversational solutions within healthcare. And then I also work part-time for a company called Renalis Health. I'm the director of product design there, and we really work on addressing gaps in care within the pelvic health space. And by that, I mean all that fun, sexy stuff like OAB, overactive bladder, fibroids, menstruation, and things like that. And so we're working on a digital therapeutic chatbot solution to address that. And so, yeah, I'm super excited to be here talking about accessibility in healthcare. The longer I've been in the industry, the more I've realized just, wow, this is really not set up for everyone. So it's a big goal of mine moving forward to try and work to equalize it. So I'm really excited to hear what everyone else has to say. Yeah, and the work that I do with Renalis, I'm really loving because it's really the intersection of a lot of different accessibility issues. There's the physical accessibility of not enough clinicians who know how to do this type of thing, like pelvic floor physical therapy and whatnot, which if you don't know now, you might by the end of the podcast, is a really big deal. And there's also a financial issue. It's very costly. And then this also concept of what I like to call emotional accessibility, just especially for people assigned female at birth, just the pelvis, the uterus, the vagina, all that stuff. It's just very charged. Usually there's kind of like anxiety, even when I say it. There's feelings of disconnect there, especially for gender expansive and sexuality expansive people. People have been through trauma. We're trained to feel shame. So it's just this area where so many different kinds of things get in the way of people in their care. So yeah, anyway, I'm super excited to be here. Thanks for having me.
Tarah, thank you very much for being part of the show with us. Our next guest is Dale LaRue. Dale, say hello.
Hi, happy to be here. Bradley, as you mentioned, I'm from Rain Agency, and for those in the voice space will definitely or may know of Rain, but we're a conversational strategy and engineering shop. So really helping brands determine their voice strategy. A lot of them entering the space for the very first time, and my role is a strategy director here at Rain. And I'm one of the internal leads in helping kind of shape Rain's point of view in developing healthcare voice experiences and voice strategies. I've worked closely with some of our pharmaceutical companies in both the consumer healthcare side as well as in the pharma space, and developing some more of the voice perspective for patient journeys along chronic conditions, and initial thinking in ways that voice in a very regulated space like healthcare right now can actually be part of that patient journey. And we talk about accessibility, helping those that are more disabled, those that require dependencies on a lot of other, whether it's providers or family members or network to take care on. We're thinking a lot of ways about how voice can have a part of that patient journey, and really think about accessibility in new ways that weren't previously there without a voice-enabled future.
Dale, perfect. Thank you very much.
No idea what that is right now.
That's someone drilling into your home, but we'll proceed. Dale, thank you very much, and the folks at Rain Agency are great. We appreciate you being part of the show. And Jon Gordon, LifePod. Jon, thank you for being part of the show as well. Tell us who you are, tell us who you're with, tell us what you do.
Sure. Thank you, Bradley. Appreciate the opportunity to be here and join this this great panel. And Dale, I've been there. I totally understand. You just can't win, but you can always hop in your car. Tarah's proven that. That's an option. So Jon Gordon here. I am CEO of LifePod, and actually been with LifePod now almost exactly 3 months. So new to this role, though not necessarily new to the voice space. By way of background, I was, this I guess does make me a serial entrepreneur at this point. Was an entrepreneur back over a decade ago, and then ended up joining New York Presbyterian Hospital, where I focused first on strategy, and then built and ran their corporate ventures side of the house, and then joined Commonwealth Care Alliance last year, which is a duals payer. So we have both Medicare and Medicaid eligible members in the state of Massachusetts. And very much relevant to this notion of accessibility. Our members have very significant healthcare needs. 2/3 of our members are under the age of 65 and qualify for Medicare by dint of either having neurodegenerative disease or severe mental illness. So obviously accessibility is very key to us. The other 1/3 are over the age of 65. Members have very high rates of chronic disease and everything that you'd expect in a complex population. So CCA, and I'll give the brief version of the story here, but CCA made a controlling investment in LifePod earlier this year, right about the time that we all went into lockdown, isolation, seclusion, whatever the term for it is, retreat in the face of COVID. And so this just feels like any other day on Zoom, I guess. But so we, CCA has very much, the way we manage the population that we have is we manage them through a lot of home-based care. And obviously in a COVID era, that's a really hard thing to do. So we switched to a lot of telephonic care. And we recognized that we were making a lot of phone calls to people on very basic needs. Do you have enough food? Do you have all of your medication? Is your PCA, your personal care attendant who helps you with your activities of daily living, are they coming to your home to check in on you and making sure that, you know, you're staying clean, you have meals and things like that. And we had worked with LifePod, which is a company that uses proactive voice to engage individuals and support caregivers using smart speaker technology. But the difference being it's proactive in that it will reach out to you and ask questions versus being reactive. And we were excited about the possibility. We'd done a pilot and we were trying to figure out where we were going with this next. And then COVID hit and we said, gosh, you know what we can do is we can take all of those sort of standardized phone calls that we have and we can replace those with automated check-ins, and therefore our care manager. So every one of our 37,000 members at CCA has a care partner or care manager. And let's give those folks the opportunity to focus on those high need cases, those high need issues that are out there, so that when the individual says, no, I don't have enough food, let's have a human intervention there. But if they have enough food and they're fine, then that's okay. So we made a controlling investment in LifePod, and I stepped in to take LifePod in its new direction. LifePod started as a one-to-one caregiver to care recipient management company, and we're building it into an enterprise solution. So I've been running it for the past 3 months, and we can get into more about what LifePod does and how it helps underserved populations as we go through our conversation.
Jon, thank you very much for being part of the show with us. Thank you to all three of you. Just very interesting, very accomplished group, and we appreciate y'all taking the time. So let's start off by asking the question, you know, I want to ask each of the three of you what's changed with your organization with the pandemic, but I'm also at the same time going to ask what's changed with accessibility in healthcare with voice too. You know, in other areas of voice, what we've seen is acceleration caused by the pandemic. We've seen, you know, the way I describe it is all of the folks who looked at voice before the pandemic and thought, You know what? There's something to that, but it's not urgent. I can sit on the fence a while longer. I don't have to act on this just yet. That's changed now. And just like in so many other things, the way that the world was moving before all this, we're now getting there faster, and it's accelerated us. And so it's a two-pronged question for y'all. And Tarah, I'm going to start with you and go through the panel in the same order I just did. Share with us a way that the pandemic has changed things for you personally with your organization, and then share with us a way that you think the pandemic maybe has changed how voice is making healthcare more accessible.
Yeah. So personally has probably been the most disruptive. Used to be based out of Mexico City. Now I'm, in the car all the time and mostly in Colorado. So my independent consulting business is relocated. But honestly, for the most part, I echo what a lot of people in digital health are saying right now. Obviously we never want to see this kind of tragedy happen again, but it really has awaken people to what digital health can do now that we're really being called in to put out these emergencies that are popping up within health and accessibility. When I first got started in voice, it was always thought of in the industry as like an inferior substitute for a human. And sometimes it is, but a lot of times, as we all know, it's really not. And I think people are waking up to the Venn diagram of that, where, there's some things that humans do amazingly and we should let them do it, kind of like Jon, what you were saying, and optimizing what is a human here for and what is digital here for. And I think people are starting to get a sense of those divisions. Like, I can sit around all day and think about what is the best way to have an emotionally sensitive conversation with someone that's going to improve their long-term health behavior change. A doctor is responsible for a trillion things, and they can't do that for everyone in every condition. And I can. So I think there's a little bit more of an openness to divide and conquer. And in this period where we're forced to make ginormous changes, it's sort of accelerating it. So I really hope that turns into something that can benefit everyone who gets health, and clinicians, people working in healthcare. I consult for a lot of startups. People are a little bit risk averse right now. But thankfully in digital health, I'm blessed to still have work and to see more enthusiasm for what this stuff can do.
No, I like that. Yeah, I like that a lot. Like just the mindset change that we're seeing. Yeah, that's excellent. Dale, same question for you. A personal change or a change that you've seen within your organization brought on by the pandemic, and then a change that perhaps you've seen with accessibility in healthcare caused by voice as well.
Well, there's something to what each of you have said so far. Brad first saying that a lot of people have thought about voice and said maybe it's not important, I can deprioritize it. And then Tarah, you mentioned that voice has this tendency for maybe specifically in healthcare to be inferior to being able to connect with a human. But what has happened in the course of the last 4 months of this year are that we don't have enough humans to go around when it comes to healthcare. And because of the shifting behaviors that are associated with what's happening right now, whether it's being remote or whether it's being more hygiene conscious, all of a sudden voice has a tendency to be a little bit more important for reasons of closing the distance between people, serving as a replacement for people, and also being something of just heightened priority from a digital behavior standpoint. So I thought those are both interesting things that I just see from general voice acceptance and readiness that I think are changing. But interesting for us at RAIN, we work and deploy experiences across a lot of different sectors and verticals. And one of the things that we've seen is that across the board, really, our branded voice experiences, whether it's skills, actions, or native, have all seen increased usage. That was especially true at the height of the pandemic in the early period of time. So it's interesting to see things that have already been built, that have already been out, start to accumulate a little bit more usage, and maybe it's rediscovering these interfaces in your home. And that's an interesting point for us as we are starting to look at growth at RAIN coming out of the pandemic. Is okay, if we're seeing some interesting data around rise in usage, what are the behaviors can we really model voice experiences around in the home? And I think I have no idea what that is over there. I'm sorry. This is my first day back in Brooklyn after being gone for a month, and I guess there's a construction that starts at 1 o'clock sharp. But as far as growth, I think because people are starting to recognize that maybe we need to start to think about voice a little bit more specifically. I think there's just a more general awareness around there has to be a voice strategy, especially in healthcare. One of the things that I've noticed as well, and just from doing, like I said, I sit at RAIN and try to continue to bring knowledge around healthcare activity to make our point of view sharper as we continue to grow relationships in the healthcare space. And the one area that I see as an immediate opportunity is the rise in this virtual care and really where telemedicine has worked prior. The rise in demand of telemedicine as a response to coronavirus is something that I've seen numbers around 1 billion telemedicine or virtual care appointments in 2020. There's just no realistic way that current infrastructure in place can satisfy that type of demand. And I think that shift to a preference of telemedicine, whether it's for COVID-related symptoms or general care or even mental health, I think that's something that is undoubtedly going to see a rise and an opportunity where we really see voice maybe as being able to reach to that. So, I guess we talk a little bit more about that as we start thinking about predictions and trends, but I think that's one of the obvious things to me is just remote care or virtual care in a place where it has to instantly change behavior is very interesting to see what's going to be born out of that.
No, that's well said. Yeah, and I think the genie's out of the bottle on telehealth for sure. And we'll probably look back and say, why did we have half of these people go sit in a waiting room, crowded with everybody else, waiting an hour longer than they thought they were going to, because the doctor had to tend to someone dying on the, in the emergency room. I completely agree. Jon, same question for you. And as you noted to start the show, your entire existence the last few months has been one of change. But I'm curious to get your thoughts on, changes maybe that you have instituted at LifePod related to the pandemic, if those apply, and more importantly, how you view how voice and AI, shifts in that landscape as a result of the pandemic that have made healthcare more accessible.
Yeah, it's. My guess is probably most of you and the viewers, listeners. I'm not sure of the format, but both may have seen what was going around Twitter. I think in April was this one little quick meme that was, "Who in your organization drove your digital strategy? What A, CEO, B, CIO, C, COVID-19." And it's really quite incredible. I mean, so in my previous role at New York Presbyterian, we spent, probably about 2 years really standing up our telehealth program at scale. And this was 2015 through 2017, basically, standing it up. We got to the same scale at CCA in 4 weeks. We didn't have a choice, though. I mean, the imperatives were a little bit different. So let me be clear about that. And obviously, NYP's done some amazing work to grow its in-demand program in the context of COVID since then. But I would say, going to the personal question, what's changed? One of the interesting things is, really is to step into a new company. I've been engaged with them prior, but as a board observer in my role from CCA, as opposed to being actively involved in it on a day-to-day basis. And to step in and, one, have the responsibility of building the trust of the organization and having them see me as, that they would be comfortable working with me and helping, sort of all come together on a vision for the business. That's hard enough to do in person. It's even harder to do when you're talking to people who you've never actually even met in person and things like that. So navigating that and continuing to build a company culture is a really challenging thing. And I think, the nice thing is, from that standpoint, I think everyone is, for the most part, pretty, the team's been very flexible. Everyone's been very flexible and engaged and sort of saying, okay, we understand this is not the reality we were sort of expecting for 2020. we've got a lot of changes going on, but we're going to roll with it. Everything's on Zoom, but you know what? We're pointing the company in a good direction. We've got strong engagement, both internally and then from our core customer, CCA. So things are pointing in the right direction. And so we're, everyone's, pulling on the oars and making the boat go one way. So I think that's been a very positive thing. And I give enormous credit to everyone on the LifePod team for putting up with me and for, being flexible and having that flexible mindset. I think there's really a lot there. But that's been probably the biggest change. Other than, I used to commute to Boston from New York City every week. And now I sit at a folding table in front of a volcano, as you can see. But so that is another big personal change. Just sort of, Tarah, just like you came back from Mexico City, same, completely feel you. And then I guess more broadly across healthcare in general and voice, I think there's a couple things, I guess, we as CCA, given, what I laid out about our membership, we're very focused on accessibility. And one of the things we did with our telehealth, and I appreciate CMS providing a waiver to HIPAA, because that's, I recognize the importance of privacy and security, but on the other hand, if you're going to make everyone, for instance, create an account and log in with an email address, well, you're going to exclude a large number of people who don't have email or don't use it regularly. And that's been a big problem, for instance, from a telehealth standpoint. And so the nice thing is, with the waivers that CMS granted, we were able to do telehealth via WhatsApp. And that's all about, and that's been our focus at CCAs, meeting people where they are. They already use WhatsApp to communicate with family members, maybe in another country or just around the US. And so if they can communicate with their doctor the same way, it's something they're already comfortable with. And that's been a big focus there. And I think voice is another thing where we're working on trying to meet people where they are and recognize that not everyone loves to text. And I've met CCA members who are incredibly facile at technology and know it really well. On the other hand, I've met people, in their 20s and 30s who don't use texting at all and still use a flip phone because that's what they're comfortable with and that's what they know. So there's a wide variety, and what we need to do is really meet everyone where they are. And I think voice has a role to play there. It's an interface that people are used to. The challenge that we have, I think, in voice is that we don't understand language. At least we haven't built a model of language that's fully functional, that works the same way this conversation is happening. And so we also have to manage people's expectations. We're providing you this device. It's going to be different than texting. But on the other hand, it's not going to do everything that you might desire it to do. And so we have to manage through their expectations. So that's one thing. And I would say one other thing to add is that I think one place we still have to go as an industry, not just voice, but overall sort of part of it's remote patient monitoring, remote engagement, just generally, I think the healthcare system as a whole is going to be more distributed. It was always going to be more distributed going forward. It can't be centralized in large institutions. It makes it too inaccessible. But generally, it's going to be more distributed. So we need to, bridge the digital divide and make sure that everyone has connectivity, because the internet ultimately needs to be a public utility. Because everyone, it's just like electricity, it's just like water and sanitation. It's essential, especially when you start talking about its role in healthcare. But I think broadly, as we look across this, because it's still early, we're still looking at these things in silos. Like, okay, this one's a voice strategy, and this is a texting strategy, and this is an app strategy, and this is a telehealth strategy. And having been on the provider side and on the payer side as well, these things need to consolidate. They need to come together so that you have one platform. It's the exact same thing when I was investing in AI for radiology. One company was doing lungs and another one was doing livers. And you can't buy 47 different things all to run on your MRI machine. And ultimately, as in an institution that needs to engage its patients, you can't have 17 solutions. And so these things do need to consolidate into a single platform ultimately, and hopefully it's not the EMR. Please, not the EMR. That ultimately these things will be driven through.
No, that's excellent. Yeah, and thank all three of you for that. I want to, there's a couple of questions that are on the docket for this, and I'm going to go off script for a minute because I want to ask about something And if I had thought about it when we were talking about this podcast before we got started, I would have mentioned it, but I'm just going to spring it on you now and get your thoughts. And I'm going to work backwards. So John, I'm going to start with you. When we talk about accessibility in healthcare, we've got what might be the greatest, most ultimate accessibility story that's about to play out. With, the news broke this morning that Oxford University thinks that they've cracked the code with the coronavirus vaccine. There's been some stories of other companies that have made progress. I want to get your thoughts, and I'll ask this, and then we'll close the show by asking about a trend, with voice. So I'll ask that at the end. But there's no way I could do this show without asking about this. What do you think that we will see with a vaccine with the coronavirus? Do you think that it will, most people would think that the vaccine will help make the world more accessible again, and I think it will, but there may be challenges along the way. And you actually spoke to several interesting things with everything you just talked about. The fact that some people don't have emails, and that denies them the ability to receive health care. There's an uneven playing field out there. I'll just sort of ask it generally, what does the news of a coronavirus vaccine mean to you in your role at LifePod?
Yeah, now I'm unmuted. And so you're asking the softball questions now, I see. It's a really interesting thing. Ultimately, I would say the evolution in the way we deliver care, that genie doesn't go back in the bottle. Some things have changed forever, whether it's the nature of business travel and business communications, the ability to work remotely. I think there's clearly small businesses and restaurants that are gone forever, which, is truly a tragedy, because those are so much of the fabric of the lives of so many people, not only for employment, but just where they find their lives. But I think the changes in terms of the way we think about healthcare, as I was speaking to a minute ago, those I think there were already some of these fault lines that you're starting to see of sort of the dominance of large health systems and things like that. And you're starting to see, as you've got your CVS and Aetna, like, what does that ultimately mean? Walmart coming in and saying, okay, we're going to, we're not only are we opening up clinics, but we're now going to start to sell insurance, which, by the way, is the first, not their own insurance. They're going to help broker others. But if I were a betting man, eventually Walmart was going to sell their own insurance. But no better way to do it than learn it by selling someone else's product. Amazon's really good at that. Then you've already started to see these trends. You just saw Walgreens announced, I think with Village MD, they're going to open up 600 to 700 new clinics. So you've got these things that are coming along, and I think adding digital into the mix is a huge opportunity. And I think, with everything we were alluding to, I think this just, the vaccine doesn't change that course. I think what it does is it allows us to, and again, I'll believe it when it happens. Number one, I'll believe it when people actually start taking the vaccine. We can't even get people to wear masks. So if we can't get people to wear masks, we also get, convincing them to actually take a vaccine is not a challenge I want to underestimate, let alone the logistics issues, the 7 billion glass vials. Let's just put that out, and then distributing it around things like sub-Saharan Africa. You talk about challenges there, but I think what it does is it allows us to start to broadly as a society, as a healthcare system, to say, okay, what do we accomplish out of this response that we want to retain? And what do we want to have come back to sort of where we were before? What's the new normal? Normal is a word I don't want to overuse these days. And I think LifePod, is going to continue to have a role in that sort of thing, because we've recognized that managing individuals' care through remote monitoring, if you layer the right analytics and insight onto that, is absolutely essential. We've realized that people don't need to go to the hospital as much as they do, and they can interact with the healthcare system through far more channels than they have in the past. And we're another resource for that. And I think that's going to be, I think our opportunity is to really seize that opportunity in front of us and really become part of that fabric of the new healthcare system.
Excellent. Yeah, no, that's great. Dale, I'm going to ask you the same question. So with coronavirus vaccine optimism abounding, what does that mean for you and for RAIN Agency? How do you view that?
Yeah, I won't pretend to be an expert on, public health and the wide scale efforts to vaccinate, but I do think that, from RAIN's perspective, where we stand on accessibility through voice and the role of, I would say, the big three, from, not to marginalize kind of any other players in voice, but the accessibility of any one person to, an Apple device or a Google enabled device or an Alexa enabled device, and the role that they should be playing in safely and factually bringing about public health in the wake of something like a widely available vaccine. Not to say that Oxford's early results mean that it's going to be widespread availability, but I go back to what I think it was what Apple and Siri did at maybe week 2 of US's shutdown, which started right here in New York. Was, there was a lot of hysteria over something that maybe was more stress related, resulting in symptoms that people thought they might be having, misdiagnosing themselves with coronavirus. And what Siri did was actually institute like a symptom checker that you could simply do right there through your mobile phone. And I think that the role that some of the big three, especially, and with their relationship to the healthcare industry, should really be about giving a source of truth, or as a way to manage information during a time where there's going to be available, obviously for cost vaccines for the uninsured and obviously for the insured as well, but also misinformation campaigns or counterpoints of view that are going to drive some sort of ambiguous gray area where people are not going to necessarily know which way to go. And given the global scale of everything that we're all going through, I do think that the big tech leaders, of course, among others, have a responsibility to leverage their access and their scale in the sake of public health. And I think we've seen a lot of that so far in the course of undergoing the coronavirus in 2020. But I think that's, to me, where I see from a personal point of view around the role of voice and the scale of these players, that they have, I think, a responsibility to do that.
Excellent. Yeah, no, that well said. And Tarah, I'm going to ask you the same thing. So within this context of accessibility in healthcare, how do you view this very optimistic news about a coronavirus vaccine? What does that mean to you?
Yeah, no, that's a fascinating question. I try to be a big optimist, and I think there are a lot of things that over time get better, but it's honestly been very scary to see the disparity in healthcare amid coronavirus. I think we've all seen the statistics about how health and safety and death is different across economic lines, across racial lines, the massive deaths in the Black, Brown, Indigenous communities. So it's I've got definitely my radar up. It's scary, but I think something that I have been happy about is to just see the people coming awake. I think much as people are becoming aware of, digital healthcare, I think we're paying attention to a lot of things. Like, we talk more about health as a society right now. We have people talking kind of like what you were saying earlier about, we can't get people to wear masks. I spend like every day thinking about how do you get people to do things that benefit themselves and society. I'm well aware that people don't do that, and now the world is too. And so maybe when a vaccine comes out, we're realizing, okay, we have this problem, we have this solution. There could be more awareness that there's actually a lot of things that stand in the way of problem and like medical solution. There's so many emotions, there's so many accessibility issues with, physical location and price point. And I think, you never want to have those barriers there, but the worst barrier is an invisible one to most people. So yeah, I'm just hopeful that we can see these things. We can see maybe things like mistrust of the medical establishment. I think I'm just reading a really wonderful book called Medical Apartheid about history of medical experimentation. When new things would come out, they would test them on enslaved Black Americans, and that mistrust still really persists in the healthcare system today. So maybe people will become aware, you know, as I'm becoming aware now of just all the stuff, all the behaviors. At Emmy, I used to spend every flu season constructing A/B tests to find out which messaging, which wording can I possibly use that will create more people to get the flu vaccine, and just studying these language things, because the flu vaccine has been around for a while. That's also something, you know, that we've shown is safe and helps communities, and still is not as widespread as it should be. Last year, when I was on a crap insurance, they wanted to charge me a ridiculous amount for the flu vaccine. So there's just still so many barriers. And so the pessimistic side of me says, beware, whenever health interventions come, they never spread across equally unless we really fight it. But be optimistic that at least people are waking up, and that, you know, we're talking today about accessibility, which I'm super pumped about. And so we're gonna be a coalition fighting for it to increase accessibility when it does come out. So thanks for that question.
Yeah, no, I appreciate all three of those answers. I think it's there's no question it's not going to be distributed evenly, and so then the question becomes, okay, well, on the margins, how can we help make it more accessible to more people who need it? And I think complicating this even further will be that it appears as if one of the things that makes this disease unique is that the antibodies don't store in your system very long. And so it appears, from what I was reading this morning, that what these researchers believe has to happen is that you take this vaccine, you know, assuming that the vaccine moves forward and it progresses to be what they hope it will be, you'll have to take it at a totally different cadence than we're used to with like the flu vaccine, where you really take it once a year. This, you have to be taking it more often because it doesn't hold up as long. And now you've just multiplied the accessibility issue 10 times over, you know, if that is the case. So it's interesting. And with this panel, I feel like I would be remiss by not asking that, because that has the appearance of being a major accessibility story of our time. I'm going to close by asking each of the three of you, and Tarah, I'm going to start with you and go through the original order. You know, share with us, you got your crystal ball out, put your Nostradamus hat on. Share with us a trend that you think that we will see involving voice, and it can be more broadly with healthcare, whatever way you want to take it, but a trend with voice in healthcare that you think we'll see play out over the rest of 2020 into 2021.
Great. No, I love this question. Love my crystal ball. Yeah, so I'll make one more narrow one within voice and then a more global one. I think within healthcare, something that I'm just starting to see the sparks of, and really hoping we can fan that and get it going, is people are more recognizing that voice and conversational agents overall can't just be these perfunctory communication mechanisms like, did you take your blood pressure medication? Yes, no. Like, that can be great. We all know that, you know, just getting the data is huge. But when you look at healthcare, the people who get the healthiest and follow more of their doctor's recommendations are people who perceive both competence but also warmth in their physicians. They've shown a really big increase in adherence to treatment regimens and improvements in health. And the same thing is true when somebody relates more to that physician. If they have this cold, unfeeling, no relationship between healthcare, like, yes, they can get prescribed their medication. Are they going to take it? Are they going to do the other things that help them feel better? Are they going to move that locus of control from outward, like, doctor's telling me to do this, to inward? I want to become healthier. And so much like we need this in our physicians to improve care, we also need that relational characteristic in bots, chat bots, voice applications. And this is something, I mean, this is why I love being a designer in this space, because I love making bots that do that. But I see so many that kind of just focus on that more like logic angle, which is important, but it's much like a doctor, it's not the whole story. So I'm starting to see that, and I think that especially as digital health pushes forward, hopefully more people will see that, and they'll see bots that can really make a bigger difference when they're designed carefully. I used to personally just run all these experiments where I would have some clients that were really controlled about what they wanted in a voice application, and other clients that were more, okay, do whatever you want. And the ones where they let us design them, surprise, did better. So I hope people, not just a purely self-serving message, but I hope people wake up to what can be done when you really put attention on those relational characteristics, and have a designer work with you up front instead of just tacking them on at the end to make the voice experience better. And another prediction I would make is, kind of like what I'm saying before about how people are waking up and seeing all of these things that aren't working in society. And I think when I say waking up, people who've been impacted by this stuff for like hundreds of years, they've always been aware of it, but society at large is now waking up. And, with all the injustice that we've seen in the health disparity within COVID, I think people are sick of this injustice and they're not standing for it. We're seeing a lot of people, speaking up, a lot of changes happening across the country in healthcare and then in politics more widely. And I think us in digital health are going to need to meet them where they're at as well, and consider where are we when it comes to being inclusive towards different groups, especially groups that have historically been, abused within healthcare or otherwise mistreated. So I think we're going to be expected to meet that and to show up for all the things that people are calling out for change on now. And yeah, I'll just tack on a little tidbit of advice. I've seen a lot of groups who are very well-meaning and want to address a lot of these things. When they don't have the expertise in-house to really address those inclusivity factors, it's always obvious to the groups that you're trying to communicate with. It just always is. There's plenty of consultants out there. I will personally help you connect with someone if you're trying to do this for your organization. But yeah, I would encourage you to avoid those missteps. So yeah, I think those would be what I think we'll see and what I hope to see.
No, that's excellent. Yeah, and I think that all of us hope that the empathy that we've seen sort of come bubbling up to the surface in many areas will continue to be present in digital health. So far, I would say it's been pretty good, but there's room for that, and I appreciate the thoughts on that. Dale, same question for you. Crystal ball out, Nostradamus hat on, a trend that you think we're going to see play out over the rest of 2020 into 2021.
Yeah, I mean, I'm going to go back to a lot of where I found ourselves as RAIN as a company having conversations prior to COVID. Because I think that there was still really a cusp of adoption of voice for more long overlooked or long just accepted as the norm type of pain points in a customer journey that were already beginning to get lifted and saying we can do this better. And I think I mentioned at the start, telemedicine is one that's a direct response to COVID, and I think that the demand of types of virtual care appointments that people are going to need to make, I think voice has an opportunity to arrive in some sort of screening practice, or maybe as a way to, better sift demand to specialists versus just general care, and really help make this new really value-added aspect of care something that doesn't get bogged down or turn people away, just as it's really needed more than ever. So I think if we are looking at one of the new behaviors out of this, or I'd say the accelerated behaviors out of COVID, I would say that voice as a way to mitigate congestion in telemedicine would be one way that would really be, I think, powerful and easy to implement, relative. Another aspect that I think we saw, we've been talking a lot about in part of a patient journey is prescription refill or prescription adherence. So there's statistics all over the place about, I'm sure everyone here is aware about the drop off in adherence and the hundreds of millions of dollars in lost revenue that adherence is a result of. And I do think that specifically and well-designed experiences that can lower the likelihood that a disabled person can't get to the pharmacy or depend on their network or something that they might need for a chronic condition, and therefore they fall off, or someone that just has, forgotten and didn't re-up or didn't go in time is just a part of daily life, another really common reason for lack of adherence. I think that trying to design experiences that are easily executed through your voice, also partnered with the rise in prescription delivery, with PillPack, in New York, it's all over the subway ads of capsule. I mean, you see the just change in how people are getting their medication. I think that with HIPAA becoming more of a compliant space for voice and conversational places to take that type of patient information and transact, I would expect that we start to see voice as a way to reduce the friction in prescription refills and prescription ordering as a way to combat adherence. And I think that's actually a space that, prior to COVID hitting was one that was really ripe to see some players, and then a lot of priorities had to shift. But I think that's one place that we would see pick back up as, especially in light of something like a vaccine where you want to focus efforts in a doctor's office or in a place for that wide scale access, and shift some of these more routine type of behaviors to something that's voice activated, frictionless, and can happen in the home. So I'd say that there's two areas: voice as a way to streamline mitigation of the congestion in telemedicine, and as a way as a factor in the battle against adherence. Two places I'd like to see and expect maybe to scale into next year.
Excellent. Yeah, thank you for that as well. And Jon, last word falls to you. Your thoughts on a trend or trends that you expect to be playing out over the rest of 2020 into 2021. And you're on mute.
It was brilliant what I just said, but we missed it. So we'll have to settle for second best here. First, I just sort of want to sort of follow up on something that Tarah was saying in her response, which is, I think one of the trends we're going to see, and this isn't voice in particular, but even if we solve, and I'm putting that in quote marks very deliberately, COVID, all the underlying health problems that existed, in January 2020, they're still there. The health disparities that she was talking about, the high rates of chronic disease and things like that. And so, yeah, COVID may drop lower on the list of the leading killers of people in this country, but that doesn't mean that heart disease went anywhere. Now, what it did reveal, however, very possibly, is that the patterns of utilization that we've been trapped in previously, because it's what we knew, that very likely is going to change. You've seen huge drops in utilization for non-COVID related stuff around the country in things like emergency room use. And some of that is going to be deferred care that's going to come back to haunt us. And in particular, not just the healthcare system, but the individuals who put off that care. And some of that turns out will probably be unnecessary. And maybe when we shift some of those things, we'll actually, we'll be changing the dynamic in the healthcare system. But I think what that ties to which is the broader point I was going to make, which is, I think as we look at all of these more virtual and distributed, because virtual is really just to enable a distributed care model, I think one of the biggest things we're going to see is we're going to see a need to, and the opportunity to engage people more frequently in their own care. And the rise of more tools related to that around remote patient monitoring. And remote patient monitoring is kind of a clunky term, so I don't particularly love it, but it does sit in this place. And that's really what we're focused on from a LifePod standpoint. And it's not just about RPM as a technology, but it's more how to, and this has always been the rate limiting factor for RPM, is it's what an old colleague of mine used to call the so what problem. Okay, this is occurring with the individual, so what do you do about it? And until recently, there wasn't enough sort of activation energy to start figuring out how to overcome the so what problem. But now that we're sort of in this world where we recognize that the opportunity to run a more distributed healthcare system is truly a viable thing, then we can and need to start figuring out the so what problem. And I think that's the interesting thing, is that voice's role that it can play from an information gathering and an information provision standpoint in a more accessible way than what we've done in the past, email, text messaging, things like that, but to open it up to more people, and then to allow us as a healthcare system as a whole to tackle the so what problem. Like, okay, we've collected this information, now how do we intervene? that I think is the exciting opportunity here that will, very likely lead to a significant transformation of the healthcare system.
Well said. Excellent. Appreciate all three of you. Tarah, Dale, Jon, thank you very much for being part of This Week in Voice, our special healthcare series, taking time out of your schedule to share your expertise as well as your experience. It's greatly appreciated.
Great chat. Thank you for having me.
Happy to join.
Thanks for the opportunity.
You got it. For This Week in Voice, our special healthcare series, episode 3, thank you for listening or watching if you're watching on YouTube. Until next time.